On the red carpet at the Oscars this weekend, Olivia Munn and her partner John Mulaney held hands and smiled for the cameras. No sign of the serious health battle the 43-year-old actress has been waging. Munn announcing Wednesday she was diagnosed with an aggressive form of breast cancer in both breasts last April and underwent a double mastectomy. Writing on Instagram, "I went from feeling completely fine one day to waking up in a hospital bed after a 10-hour surgery the next." Munn, who many know from her role on HBO's The Newsroom, writes, "I'm lucky. We caught it with enough time that I had options." She says Dr. Thais Aliabadi saved her life when she did a breast cancer assessment. Munn's score was high, 37%, according to the actress's post. What does that 37% mean?
In her case, 37.3% was her lifetime risk for breast cancer. And the way I explain it to my patients, if you had a 37.5% chance of boarding a plane that would crash, would you ever board that plane?
Dr. Aliabadi sent her for a breast MRI, and that's when they discovered the cancer.
Olivia says that she wasn't going to be going in for another mammogram for a year. What would have happened in that year, potentially?
Her cancer would have grown. She had an aggressive cancer.
Along with thanking her doctor, Munn thanked Mulaney. The couple have a son together. "I'm so thankful to John," she writes, "for being there before I went into each surgery and being there when I woke up, and for placing framed photos of our little boy Malcolm by her hospital bed." Also sharing a cautionary tale, actress and model Christy Brinkley, who posted photos of the procedure she had to remove skin cancer from her face. Like Munn, she writes, "The good news for me is we caught the basal cell carcinoma early." Brinkley adding, "I was lucky to find mine because I was accompanying one of my daughters to her checkup." In her post, she reminds people to get regular total body checkups and slather up with sunscreen. Two different women, each with scary personal stories to tell and important health messages they hope will help others.
Brinkley says she had a little dot on the side of her face and just asked the doctor to take a look. In her words, he knew right away. A reminder that doctors can sometimes identify a problem quickly. As for Olivia Munn, she has a lot of support around her. Her partner, John Mulaney, commenting on her announcement post, saying, "Thank you for fighting so hard to be here for us. Malk and I adore you." Guys.
All right, Steph, thank you. Let us bring in NBC News medical contributor Dr. Tara Narula. So something so interesting in the Olivia Munn story, this cancer risk assessment tool, which is something that she credits for saving her life along with her doctor. So tell us a little bit about that.
Right. So many women have not heard about this. It's not really brought up with their OBGYN or primary care doctors. We know about mammograms, but this is a tool online done usually with your healthcare provider, although you can do it on your own. It takes about 5 minutes. And really what it does is give you a sense, are you low risk of developing breast cancer? Are you high risk at 5 years during your lifetime? The most common model, you can go on and look it up, is called the Gale model. It basically looks at 7 factors: your age, race, ethnicity, whether you've had a breast biopsy, has that breast biopsy showed atypical cells, what is your family history, when did you first get your period, what age, and when did you first have your first child. And it will tell you your 5-year risk if it's high and your lifetime risk. The reason this is so important, if you have a high risk score, then it can help you in the sense that you may be asked to get genetic screening. You may be having conversations around surgery or around drugs like tamoxifen or those types of drugs that can decrease the risk of developing it, or even getting MRIs, as Olivia Munn did in this case. So it can really change your management, and it's so great that we're talking about this.
And this, do I have it right? Her mammogram was fine.
Yes.
Then her doctor took it upon herself to do this risk assessment.
That's right.
Then she got checked out and finds out that she's got cancer.
I feel like mammograms miss a lot.
They are not perfect. They are, one of the better tools that we have, but sometimes they will be combined with things like ultrasounds or MRIs in the right setting.
All right. Thank you, Dr.
Thank you.
Thank you.